My clinic was open throughout the corona period till now. Now we are functioning normally. But initially there were hiccups. The police used to stop us. But now when it was clear that health is an essential service, they let us come here and we used to come. But then there was a problem because the patients did not have a transport. They were stopped by the police people. But then emergency patients used to come. One lady was with herpes zoster ophthalmicus. If we could not have seen that patient during that time, we could not have saved eyes. In the lockdown period, all the kids were homebound. There were no outdoor games. So in the homebound games, while playing, they used to injure their eyes. And then it was an emergency. They used to come to the clinic and we used to treat. It was so gratifying at that point of time.
I am Dr. Preetham Samant. I am an eye surgeon. I am the director of the Eye Associates Mumbai. I am also an associate professor at JJ Hospital and Grand Medical College Mumbai. Right from day one, I have been working. I have made sure that all the patients with eye problems are attended in due time. There were many patients who came with emergency problems such as infections in the eye. There were many patients who came with injuries in the eye. And I had to make sure that these patients got the treatment. We even carried out surgeries during these tough times. We had to carry out these surgeries using utmost precautions, wearing all masks and PPE that was recommended by various authorities to make sure that while giving eye care, we did not spread coronavirus. There were many babies and pediatric patients who required emergency eye care, and I made sure that I was available for that too. And a very well-trained team of staff at my clinic and my eye center are helping me in this endeavor to carry on this good work.
The first sector started functioning and came forward and started serving the society is pharma sector. There are nearly 12 lakh pharmacists working from the day one of the lockdown. These people are working day and night, 24/7 throughout this pandemic situation and making available the regular drugs for common diseases and drugs for lifestyle disorders and drugs for non-communicable diseases. Nearly 100 pharmacists succumbed to this COVID-19 and more than 1,000 pharmacists were exposed to this COVID-19. The total deaths due to this COVID-19 pandemic in last 6 months, as per the data given by the government, it is below 1 lakh, that is around 90,000 till yesterday. If you take the statistical data of the average deaths in India taking place due to non-communicable diseases and lifestyle diseases, 2 million people are dying every year, and it is almost around 60% of the total deaths occurring in India. These non-communicable diseases are hypertension, stroke, obesity, diabetes, coronary obstructive pulmonary disorders, respiratory diseases, cancer, premature mortality, neurological disorders, depression, etc. etc. Pharmacists are making available the medicines for these non-communicable diseases. There are nearly 2 lakh pharmacists are working in pharma industry at various capacities, 24/7 and in 2 to 3 shifts, manufacturing the drugs continuously and supplying it to the market without any interruption, looking at the supply chain management and all the other parameters involved in manufacturing and supply of drugs to the market. There are nearly 2,000 drugs inspectors, both at the state level and central level, working right from the day one of this situation and monitoring the manufacturing of the drugs and also monitoring that there is no black market of these life-saving drugs by any pharmacies in India.
Hi, good evening everyone. My name is Ashraf Biran. I am the promoter and director of the company called as Wellness Forever Medicare Private Limited. We run a chain of day and night pharmacies, around 200 of them, across 3 states. It's been a real pleasure and honor to actually serve the community at large when during the pandemic and the COVID times, we could do a job which we thought was a very difficult one. And it was all through a lot of support from the team and everyone in the company who actually contributed to see how we can serve you better. First and foremost, we were very fortunate to have a warehouse which we have in Bhiwandi, through which through the entire pandemic we could serve the customers well. We know there was a lot of panic buying. People were scared whether they are going to get their medicines or not, and especially chronic patients like people who are there on blood pressure, who are there diabetes and all that. But I think yes, to a very great extent, we did take control of those things and we were able to serve those chronic patients during chronic times. During pandemic times, thank you very much for that, and we are very, very glad to be helpful and supportive there. As far as the team which actually stood by us to make this possible, we did quite a few things to see if we could actually make the stores running. And one of the initiatives which we took was that we started actually transporting our staff from their residence to the store. Second, we tried to do a little bit in terms of how to make them comfortable at the store. And not to mention the least, we have quite a few heroes. I would say all the team is actually, all of them are great heroes. They have really served through a lot of dedication. They have really served too much of commitment to see the patient actually get the service which we wanted to give.
I'm Rahil Shah, Director at NM Medical. NM Medical is a chain of diagnostic centers with laboratory, imaging, and preventive health screening services across multiple locations in Mumbai, Pune, and Bangalore. The COVID era has presented a bunch of unprecedented challenges to diagnostic centers and the healthcare industry as a whole. In fact, in our 40 years plus of existence, we can't think of any other time that's been as challenging as the current COVID era. Firstly, from a customer standpoint, we had to implement a number of safety and hygiene measures to instill confidence in both our patients as well as referring clinicians that it was okay to visit a medical facility during this time. No cost and effort was spared to ensure that every safety protocol could be put in place for both our patients as well as our staff, so that when one visited the center, there could be no concern of acquiring an infection at any of our diagnostic centers. Whether that included putting in safety gear like PPE, sanitizers, gloves, masks, face shields, or investing in best-in-class cleaning services, professional cleaning services in some departments like CT scan after each and every patient. In other departments, periodically every couple of hours, and in the general waiting areas every day at the end of the day, with defogging, cleaning, deep cleaning, sanitization. No effort was spared. And this was visibly evident to patients who visited our facility. So that created a confidence in them that it was okay to visit our diagnostic centers during this time as well. Second, we ensured that there would be a lot of respect for their time when they came to our center. So we moved to a culture of providing tests primarily by appointments. Previously, tests that we would allow on a walk-in basis were shifted to an appointment schedule largely. And that ensured that everyone who came in was taken on time and did not have to spend any more time than what they needed to in our medical facility. Now, from a staff standpoint, so the biggest concern for us was how do we provide our services if staff can't make it to our diagnostic centers. Now, I must say that our staff and doctors have been the real unsung heroes, the COVID warriors during this time, particularly the ones who were able to convince their families to allow them to come to work despite all the challenges of lockdown, the fear, a lot of rumor mongering. WhatsApp is a very dangerous tool. We were able to counter all of that with constant communication to our staff. Top management was available. HR was available to speak to each and every staff member or family members of staff who had concerns. And we created support structures for them, whether it was providing private vehicles for them to get to work and drop them back home, giving them letters and special IDs that allowed them to commute to work without any harassment from the cops, from the local authorities. Enabling them to travel by train and bus when those options were opened up to healthcare workers, essential service workers. Talking to societies of staff where they stay, where the society members and society chairs were reluctant to allow those staff members to go out to a medical center, counseling them and explaining to them why it was okay for the staff to come. So a lot of effort was put in to ensure that they could come to work in a timely manner and complete their task, whether it was a radiologist performing an ultrasound, an X-ray technician taking an X-ray, or a lab technician processing blood samples in our laboratory. We were able to ensure that they came to work. Now, when COVID first broke out, our molecular lab, did not have the NABL accreditation required to begin COVID testing, and that's because our molecular lab was started relatively recently, just earlier in the calendar year. So we had to go through an arduous setup process, including an 8-hour online audit with NABL in mid-May to get the permission to begin COVID testing. So after a lot of persistence, a lot of effort from our staff, follow up with NABL for them to be convinced that yes, an online audit can be done. We finally got the approval to begin COVID testing by end May, and we began in early June. From then until now, we've completed close to 20,000 COVID tests for patients in hospitals, in their homes, in institutions, a variety of settings as permitted by ICMR and BMC. And today we're proud that we're probably the most comprehensive COVID testing service provider in the city. We're able to provide the entire basket of services end to end, from a swab PCR test to a swab antigen test to an antibody blood test to a chest CT scan and a chest X-ray. So the entire bouquet of services and all the blood work as well that would be needed for COVID patients is available at NM Medical across multiple locations.
health services was going on, particularly hospitals, their staff, police, all were working, but there was no transport system. BST has taken that challenge, and with our 3,000 buses and almost 22,000 employees, and we have given a very good service. But whatever their facilitation was expected, nothing was done for them. Our employees were directly in the services with the passengers, COVID patients. We were transport COVID patients. We were transfer our buses, converted our buses into the ambulance, and there was no ambulance in Mumbai city. Shortage of ambulance. We have converted our buses into the ambulance, and almost in all hospitals our ambulances was there. And because of this, our 1,700 employees affected by this coronavirus, and out of that 125 employees are dead. We lost them.
पुलिस 24 घंटे राउंड द क्लॉक 24/7 कर्फ्यू और लॉकडाउन की कंप्लायंस कराने के लिए सड़कों पे है। जयपुर में लगभग 10,000 पुलिस वाले पिछले 1.5 महीने से 20 मार्च से आज तक लगातार बिना घर गए, बिना रुके, बिना थके हुए इस काम को कर रहे हैं।
তোরা বাইরে ঘুরে করবি চিতা জরুরি দরকারে ছাড়া কেন ঘোরা পাড়ায় পাড়া জরুরি দরকারে ছাড়া কেন ঘোরা পাড়ায় পাড়া আর কটা দিন ধৈর্য ধরা নইলে অমঙ্গল ওরে আর কটা দিন ধৈর্য ধরা নইলে অমঙ্গল তোরা বাইরে ঘুরে করবি কিতাব এদিক সেদিক ঘুরে প্রাণটা কেন যাইবে ঘুরে মিথ্যে এদিক সেদিক ঘুরে প্রাণটা কেন যাইবে ঘুরে ভিড়ের থেকে থাকলে দূরে করোনা অচল ওরে ভিড়ের থেকে থাকলে দূরে করোনা অচল তোরা বাইরে ঘুরে করবি কিতাব মোরা এই কটা দিন ঘরে থাকি ও